having an amazing day. It's time for a health check. So my oldest daughter recently had a medical procedure. It was about 3 weeks ago now, I believe, at this point. During that medical procedure, during her prep, the nurse that was trying to put her IV into her right arm caused severe nerve damage. When he was pushing the needle into her arm, he was pretty much striking about 3 or 4 of her nerve tendons. So during that time, she ended up getting severe pain. She started feeling, she was okay for the first few days. She was just having pain around her abdominal because of her procedure, which was normal. She ended up getting hematomas after the surgery, so she was being monitored for that, and she was having severe abdominal pain. But within a week or two, actually within the week, maybe, she started to have severe arm pain. We later found out after her CT scan, we ended up finding out that she had damage to her C5, 6, 7, and 8 nerve and her T8 nerve. Each of those nerves are currently causing her to have severe arm pain. She's currently feeling some numbness in her fingers. So we're trying to obviously get that addressed right now, and it's become pretty significant where she's having trouble lifting her arm. She's having problems just even grabbing anything. She is currently going under, she's currently in therapy. So she's doing cupping right now, cupping therapy for her arm. Hopefully that will continue to make her feel a little bit better. As she's noted, it does make her feel a little better, but it doesn't last. So it's really difficult for her to sleep. She's still struggling a lot. So hopefully, eventually she'll start feeling a little bit better. Now, she did go see the doctors. The doctor told her that he has to determine whether or not she had any herniated disc in her neck before they proceed with any other issues. Obviously, he wants to rule out everything, make sure that there's nothing else causing the pain before he proceeds with what are the options for her. It's really frustrating right now because when it comes to my daughter and IV installs, let's just say that, it's really important for us to have the right nurse with, the most in-depth knowledge and understanding of how to work with patients that were on dialysis. That's one thing, because there's a lot of, obviously there's a lot of damage. It's really important for us to find the right nurses, because obviously that understand how to put it in an IV to a patient that is just very difficult to find those veins, right? So we typically ask for the best of the best nurses to help us. This individual nurse kept expressing how knowledgeable he was, because he's been there for a while, and we hear that a lot. And we will say no, and then they will eventually try because they feel the vein and they say they can do it, they got it, blah blah. And we always run into an issue with these nurses. And again, we do the whole 20-minute, no, we need a specialist, no, we got it, no, they're not available, no, they're doing. So it's really important for you to advocate for yourself and for your child, especially when it comes to these specific incidents, because this could have been avoided. It's extremely frustrating because now it's double the time of recovery for my daughter because of the lack of ability of this nurse to avoid causing so much damage. And when he initially tried to do it, she was pretty much screaming, so we could tell that it was already an issue at that point. So again, it goes back to, we go back to the same routine. They call someone else, that person does it after several, minutes of prepping up and making sure that they're good to go because they're cautious now. But at this point, it's already caused the damage. She's already in pain just from the initial poking, right? So I cannot express the importance of finding the right nurse that understands the importance of, or how careful they need to be when installing or pushing in a needle. Because if you don't get there, right, if you don't do it correctly, then you're in trouble. You're causing damage, you're causing pain. Now that that individual patient is afraid of you, doesn't want to have you touching them, even though you might be good at it with other patients, you might not be as good because of all the damage to their arms, because of prior needles, because of all the needles they've had to use when they were in dialysis. Just the damage from scarring, right? Just from all the constant needles from her blood work and her dialysis and stuff like that. So that's something that we're currently working through, obviously. But nurses need to be more aware of that stuff, or not sure if that's part of the practice, right? So we have to make sure that we get the right nurse to support my daughter. We have to get the right nurse to support my daughter, because she has so much damage or scar tissue from all of the needles that she's had to endure throughout her life. So making sure, again, we go back to making sure that you advocate for yourself and for your child or your loved one to ensure that they get the right person there to support you. We're usually pretty good with that, but we trusted this one nurse and we let him do it because he was extremely confident, and then this happens. So again, go back to making sure that you know your rights, you know what to ask, you know who to ask for when you need to. You want to make sure you get the best of the best nurses when you're getting any type of IV put in, because it can cause some severe damage. And also you want to make sure that they can do it quick and easy without you feeling a lot of pain. All right? Okay. Thank you so much, guys, for joining. Hope you're having a great day. And please don't ever forget to just focus through and evolve. Ciao.